So you're a woman in your 40s and you're getting a lot of targeted posts about hormones and you're wondering if it's time to start hormone replacement yourself. Let's talk about it. Hi, I'm Athena Newell, family practice nurse practitioner and functional medicine provider at Stat Wellness, and I work with women every single day to optimize their health and metabolism and help them feel their best. So let's talk about what perimenopause and menopause is and how we can help patients really understand what's happening in their body during this transition. Most women think that menopause starts when they start to miss their periods and are getting hot flashes or night sweats, but those are actually late symptoms of perimenopause. In reality, the first signs of perimenopause are things like sleep disturbance and mood changes, and that can happen for years leading up to menopause. They start to experience fatigue and changes in their body, and they don't really understand why. And for many women, this can start in the late 30s and early 40s. So now let's talk about the difference between perimenopause and menopause. So perimenopause simply is just the transition between reproductive age and menopause. This can last between 4 and 10 years. Hormones, especially progesterone and estrogen, start to fluctuate during this phase. Specifically, progesterone can go down and estrogen can go up and down. Month to month can be different. Menopause is a single point in time. This is when you have not had a period for 12 months. Everything after that menopause point in time is considered postmenopause. When we're talking about symptoms, most of the time these symptoms are happening during the perimenopause phase, which can be 4 to 10 years. When does perimenopause start? Research shows that perimenopause can start as early as the mid-30s, but most commonly, symptoms will start to arise in the early 40s. And symptoms often start to change before your periods ever do. And that's where a lot of women and a lot of healthcare providers, to be honest, can drop the ball. Let's talk about early versus late symptoms of perimenopause. Some of the symptoms that I'll start to see in early perimenopause are sleep disruptions. You might see a harder time falling asleep or staying asleep, mood changes, especially anxiety and irritability, fatigue, decreased stress tolerance, brain fog, and subtle body composition changes despite no lifestyle changes. These symptoms are often blamed on stress and being a busy mom, or we're just getting older. But hormonally, hormones are changing during this period of time. Mid to late perimenopause, we might start to see cycle changes. They might be shorter, longer, heavier, more painful, more PMS symptoms, and that can be very annoying. And late perimenopause is actually what most people expect to experience during this time frame, which is real changes to your cycle, hot flashes, night sweats, low libido, and vaginal dryness. This is associated with a more obvious decline to estrogen hormones. Some symptoms that might be overlooked are joint pain and stiffness, and an increased risk of frozen shoulder or adhesive capsulitis. So what is actually happening during this phase? During this period of time, our body is getting farther and farther away from that optimal childbearing time frame, which means that our hormones start to change. Progesterone can decline first, estrogen can go up and down, we have unpredictable ovulation, and testosterone can decline too. With progesterone, we see sleep changes and mood changes. Estrogen fluctuations affect your brain, metabolism, and inflammation. Cortisol can become more reactive when we have a bit less stress tolerance. Blood sugar starts to be unstable during this time frame too. We also have to consider things like thyroid function, muscle mass, and metabolism. This isn't just a hormonal issue, it is a whole body shift. But what I think it's really important to focus on is the foundation. Before we jump into hormone replacement, we have to make sure that those foundational things are in place, because those are things that are going to carry us through all the way into postmenopause. Number 1, blood sugar stability. Prioritizing protein with every meal. We don't skip meal. And we try to reduce glucose swings by limiting refined sugars and ultra-processed foods. Strength training. This is critical for maintaining muscle mass, metabolism, and hormonal balance. Ideally, we're doing strength training between 3 and 4 days a week. It can be hard to maintain. So sleep is a non-negotiable, even if we have a really hard time controlling it. Do what you can to support your circadian rhythm, like getting outside in sunshine in the morning and at night, keeping your room cold and dark, and going to bed and waking up at about the same time every day. Stress regulation and nervous system support matter more than you think. Incorporating things like walks, breath work, prayer, and meditation are all things that can help support your nervous system. And of course, nutrition. Prioritize things like protein, fiber, and micronutrients, foods with lots of color and are very filling, because under-eating can backfire. So when would we consider hormone replacement therapy? If you're doing it all right and you're still feeling really poorly, hormone replacement therapy can be life-changing in the right patients. So first, I'm going to focus on getting my patients' medical history and their reproductive history from the start of their cycles until now. What's also really important is to get their medical background, like if they've had a history of cancer, any family history of reproductive dependent cancers, or any history of blood clots. The first hormone I like to use when I do replacement therapy is progesterone. This can support sleep, calm the nervous system, and help with anxiety. Number 2, estrogen replacement. Estrogen and progesterone have to be paired together in patients who still have a uterus for safety reasons, always together. This can be used later in the perimenopause phase as we have consistent low estrogen symptoms. It can be used at low doses even if you're still having a period. Testosterone can be great for mental clarity, mood, energy, and libido support. And this is often overlooked in women. This isn't about jumping straight to hormone replacement, but it is about strategically providing support so that our patients feel better and have a better quality of life. If we pair this all together, we can focus on lifestyle, supplementation can be supportive, and in the right patient's hormone replacement can all be added to optimize our patient's quality of life. So if this sounds like you, or you're starting to notice these changes, I would love to help. We take a root cause, whole person focused, evidence-based approach to care at Stat Wellness. You can book a free 15-minute consult using the link below, and we'll figure out together what's actually going on and what the best next steps are for you. Thanks for coming.